My name is Forrest with Texas Children's Hospital, and we're here in the HR Comms studio talking to Dr. Grace Johnson and Dr. Carrie Eppes discussing maternal-fetal medicine. Welcome, Dr. Johnson, Dr. Eppes. We're excited to have you here in the studio.
Thank you, Forrest. We're happy to be here.
Yes, thanks for having us.
So I just kind of want to start off and learn a bit more about each of you individually. Can you tell me about your background and how you got to Texas Children's? We'll start to you, Dr. Eppes.
Sure. I was born in Maryland, and my family traveled a bunch of different areas in the U.S. and then finally settled in Texas for a period of time. For me, that's when I met my husband, and then I moved him all over the U.S., and our agreement was to come back to Texas. And I actually came right out of fellowship to a job at Baylor in Texas Children's. And it has just been my dream job, and I don't anticipate ever leaving it, mostly because the people I work with are now like family. And I now have 2 little girls and 2 Great Danes, and we're all very happy here.
What about you, Dr. Johnson?
So I'm from Austin, Texas, and went to college there and never would have left if there was a medical school when I graduated, but there wasn't. Baylor College of Medicine was my dream medical school, and so when I got in, I knew that's where I want to go. So I came here 12 years ago to Houston. Met my husband in my medical school class. We got married, both did our residencies at Baylor with Texas Children's, and then both stayed on for fellowships. I did maternal-fetal medicine. And then this last year, as I was preparing to graduate, we just opened our new campus in Austin with Texas Children's. And so I was very grateful for the timing that coincided. And so my husband and I moved back to Austin with our then 3 kids, now 4, and have been very happy there for the last year.
What's going on in Austin?
It's very exciting. We have our new hospital, the North Austin campus, that opened in February of 2024. I'm part of the Women's Services Department, the Women's Services group. So we have an OB group. We have a maternal-fetal medicine clinic. A lot of the pediatric specialties are up and running. A lot of the first surgeries for each specialty are underway.
How are we feeling about it in Houston now that we've expanded to another region? How are the doctors talking about Austin, collaborating across the board?
Entire pavilion is set up to support maternal care. You're never having to make the argument about why taking care of pregnant women is important. That's actually why the hospital exists.
Right.
So everything they do is how can we optimize, how can we adjust to support and have better outcomes. So that's been wonderful to be a part of. And it also means you're constantly getting to be innovative and adapt to the population. So as people need various services, we bring them in. And so that's been really meaningful to be a part of. So many parallels between our 2 campuses, but so many things that are different. And I think as we know, the growing population in Texas and the needs across our state, it's nice to be able to expand into a different area to support them.
Well, at Texas Children's, we like to say, the difference is life-changing. As clinicians, you are the difference. So what to you does that mean? What is the difference, especially working at Texas Children's?
I was thinking about, as Grace was saying, so much of the difference is the culture within our hospital as well. So whereas in some places I've worked before, if somebody might see a patient and then you have to read their note next time. Even last night driving home, I was getting a call from a radiologist who read a scan about a patient I had so that we could talk through it together. So the thought is we always go the extra mile and interact and make sure we have a common understanding of what's going on. And you see the impact that has on patients when they're not having to coordinate us all together while they're going through a stressful scenario. They get to feel like there's a network around them supporting them to help navigate them through that.
I think that's very true. And especially being in Austin where everyone's new and very excited and willing to engage. We had a patient come with a late diagnosis of a severe anomaly. And within a day, my nurse coordinator had contacted the pediatric surgeon, the director of the NICU. It was the best thing for the patient. She was completely overwhelmed, and her partner, they came in. They were able in an hour and a half to get, meet the people that were going to be caring for them, for their baby. A lot of information that was really helpful as they were trying to swallow what was going on. It's been nice being on the ground in Austin and with the leadership we have there. I feel like it's been a good balance of freedom to change it and freedom to make new suggestions and to figure out our clinic, but also a nice net to fall back on to say someone else has figured this out before. We don't have to completely
Reinvent the wheel. Yep.
Exactly.
Yep. Yeah, I've heard that a lot about Austin. It's just like it's great to have, Houston in the back corner and, having people to lean on. But it seems like a lot of people have the freedom to do their own thing and set a new precedent in Austin with this new hospital.
Yes. So I took the job in Austin as a new grad, knowing that all of my former faculty members, now colleagues, were literally a phone call away, with the same EMR, with easy access to Microsoft Teams. And it's at least once a day in my clinic that I'm calling someone in Houston to say, hey, can you look at this scan with me? Or what do you think about this plan? And within seconds, they can be in the chart themselves, consulting, looking at the same images I am. And it's just been hugely invaluable to me being in Austin to have the whole resources of the MFM department here in Houston.
Is telemedicine impacting your line of work in MFM at all in a major way?
Oh, definitely. Yeah. I think once we adapted so much after the pandemic, it just made us realize how much more accessible it is for patients, and kind of expands who you can reach, so they don't have to drive and do a whole day and spend all that time. So yes, very, very much. A lot of the consults that we do, a lot of the second opinions, a lot of the other services like our dietitians and our genetic counselors, it makes it kind of come to the patient a lot more. So it makes it all much more accessible.
I think MFM is uniquely situated because the MFM can also cover a wider area. If the imaging can be done locally, so the sonographer goes to a more remote clinic. We have this a lot in Austin. If patients, living out in these more remote areas, the sonographer can go out there. The MFM can read the images from anywhere and provide a high level of consultation.
How has, motherhood, impacted your view on practicing?
So I have 4 kids who are 4 and under. So I'm in the thick of motherhood right now. My first daughter was born when I was a chief resident here at Baylor, was born at Texas Children's. And then I had preterm twins at 33 weeks. And so experienced a twin pregnancy and then a NICU stay. And I think now in practice, it gives me a much, I feel like compassion is a trite word, but much more ability to put myself in someone's shoes and realize this is a big moment for them. And I think the humility to realize I can be here with them, but this is their journey and this is their life, and they're going to experience it how they will. And I think it's just given me an appreciation for the gravity of what having just a normal pregnancy is and how that changes you, and then especially having a high-risk pregnancy.
Sure.
And I experienced just my experiences was my own, and thankfully my kids did well and are past those stages now. But I just sit with patients, I think, in a different way now as a mom, and thinking about their other kids at home and the things that they had to do to get to the appointment and what they're thinking for their future. I think that shifts once you've had kids.
Sure.
Yeah, I totally agree. I think I've had also very complicated pregnancies, and I think initially that gave me a different perspective and a different understanding of trying to see it from the patient side and experiencing it from that side. And I think now as my kids get not old, but older, realizing that they're getting closer to when they will have kids, and that I want our system to be as good as possible when we get to that point for them, and knowing how much we still need to do in that area. But I think mostly just really giving you perspective. And I agree with Grace. I think sometimes you can relate to how you felt in that moment, but also realizing each one is their unique experience and journey. And so trying to just pause and listen and adapt because of it. But it made it all much more serious and more enjoyable and beautiful, because you know how wonderful it is on the other side, and you want to get them to that point.
So looking to the future, you're just kind of talking about that's the vision, right? Is connecting the different types of specialties, providing more comprehensive care across the board. What does the future of MFM look like to you at Texas Children's? And also, considering training the next generation of MFM doctors?
I think it's mostly just continuing to meet the needs of the patient population that we serve. And it changes so much. The women are making different decisions as far as when they'll have children. So sometimes later than they would have before. People who previously probably didn't think they could get pregnant, who have been in the Texas Children's systems as kids themselves and might have complex heart disease or have gone through cancer treatment now, are getting pregnant. And I think as much as we have a vision, I think what's really important is that we also are able to watch what's going on around us and realize, all right, we need to expand this. We need to do this.
MFMU network it's very hard to do research in pregnant women, and a higher level of evidence is needed for a lot of the things that we practice. And the MFMU is a big partnership among how many sites? 12 sites to try to get enough patient enrollment to really get data on some of these big questions in obstetrics and maternal fetal medicine to improve maternal health, because it's hard to do at a local level. You can't really get the funding you need. So that's something new since in the last 2 years. 1 to 2 years. So that's in my mind, a huge step for the department and in maternal health.
Thank you so much for joining us and telling us a bit about the Maternal-Fetal Medicine Center at Texas Children's. It was a great discussion, and we appreciate your time.
Thank you.
Yes, thank you.